Hi, this is Matt again. I'm still here in Malawi, and I'm doing the video because today I had my first interaction with the Malawi Healthcare system. And from all the things that I was told, don't trust the hospitals or the healthcare system there. It's a it's a developing country, and they make it sound like you're going to go into some witch doctor who's boiling a machete to cut you open or something. But it wasn't like that at all. There's two types of hospitals here. There's private hospitals where you pay out of your own pocket, and then there's public hospitals which are free to the community. Okay, so and there's some pretty good hospitals, contrary to what I heard. I had been to Malawi. First trip here, I was here in May and June. Made sure that I was in pretty good shape before I came here. I got all my blood work done. I went back to Philadelphia. I was back there in July and August, and I was having some real bad problems with my eyes. And so I went to an ophthalmologist there, and I was diagnosed as being glaucomic or pre-glaucomic. There's a lot of pressure on my ocular nerve. So anyway, first thing they want to do is, immediately do some sort of laser eye surgery because I have cataracts too. Now, I don't want to go through all that. That would take like a month of sitting around in Philadelphia with bandages on my eyes. I didn't feel like doing that. So they gave me the eye drops, came back to Malawi, and they wanted me to come back in December, so I did. And, well, the glaucoma, it didn't get any worse. It actually didn't get any better either, maybe slightly better. But I was just really happy that I didn't have to, worry about immediately getting eye surgery. Now, the other thing that was a real bother for me was that about 2 years ago, my primary health care doctor retired. And I've been seeing this guy for like 35 years. And my whole family has seen him too. And he's a great guy. And he still maintained, his own practice. And he wasn't part of some larger, network or PPO or anything like that. And one of my issues, I've been being treated for ADHD for like, almost 35 years. I was diagnosed, in my late 20s. I was a stockbroker for years. So I was prescribed Adderall. First it was Ritalin, then it was Adderall. And the only thing I can tell you, and then I had Vyvanse for a while. The only thing I can tell you is it really made a difference in my clarity of thought, my organizational skills, and just being an effective human being. After he retired, I've been basically without a primary health care provider for 2 years. Every time I tried getting to see somebody, I was told, well, you're going to have to wait. Our backlist is a month or two, and this, that, and the other thing. All I wanted to do was get blood work done. I wanted to get the wax cleaned out. I wanted to be able to hear out of my left ear. And I also wanted to get somebody who could, write me a script for my Adderall. Well, it was just impossible. They wanted me to wait a couple months to get in to see a primary doctor. And, well, the only thing they could offer me is to go see a resident physician. And then if I needed to get my ears cleaned out, I'd have to wait another couple months to see an ear, nose, and throat specialist. So I was like, I'm not waiting around another 3 or 4 months to get my ears cleared out. I'm just going to go back to Malawi and try it down there. And then you hear all these things about Malawi. Don't go to the hospitals there. The healthcare system's horrible. The mortality rate is really low. Blah, 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 right? Well, my significant other, Trudy, told me, go to this place, it's a private hospital. You have to pay out of your own pocket. But, the good thing is it's a lot quicker. There are two types of hospitals here. A private hospital where you pay out of your own pocket. A public hospital, which is free to the community, but the waiting period's a lot longer. So I went to the private hospital. Unlike going to a physician's office for the first time in the United States, they don't hand you a clipboard with 12 pieces of paper in it that you have to fill out and document your complete medical history, your medical history of your family, all sorts of other stuff. It was a one-page sheet. Asks you your name, date of birth, your sex, your address, your phone number, what you're here for. And that's it. Now you're going to pay. And I do have medical insurance. It's back in the United States. I was going to get travel insurance, but the numbers that I was being quoted were like $400 a month, and you got to pay first, and then you're lucky if you can get reimbursed. I think, no, I'm not doing that. I already have a good health plan, except you just can't get in to see a doctor back in the United States, and that's running me $400 a month. So I wasn't signing up for anything like that. So much to my surprise, I got in there within 10 or 15 minutes of filling out the paperwork. I was back to see the doctor. I went off talking about all sorts of other medical issues. He really wasn't that concerned. He's just like, well, let's get through here, let's clear that out, and come back next week and we'll do a follow-up and give you an ear test. If you have any other medical concerns, you can discuss them then. So I was in there for about 10 or 15 minutes. He did a great job. He cleaned out my ear. It's just like the first time in a couple of years that I can hear. It's still a little bit muffled, but it's like 90% better than what it is. So my experience at the Malawi Healthcare facility was great, better than I expected. It wasn't in some village hut with a guy in a tiger skin outfit with a machete waiting to operate on me. It was nice. They had everything there. They had, cardiology, oncology, neurology, internal medicine, emergency. Excuse me, I have a slight cough. So I was in and out of there in half an hour, and I'm finally hearing okay out of this ear for like the first time in 2 years. So I was amazingly surprised and shocked at how well the Malawi healthcare system actually was. Now, I'm not saying that if I was diagnosed with cancer or I needed open heart surgery or something like that, something very serious and life-threatening, that I wouldn't, decide to go back to the United States and get it done there. But I can tell you this much. My experience in the U.S. healthcare system has just been terrible since my primary doctor retired. And I was shocked and quite frankly amazed at how well the Malawi healthcare system performed for me, despite the fact that it wasn't anything major. It was quick, it was inexpensive, it was 55,000 kwacha, which my Forex, where I trade my dollars, it comes out to like $15, which is less than what my copay would have been back in the United States. So my review of the Malawi healthcare system, from what I saw, it's really good. Fortunately, I wasn't in there for anything real serious or any kind of invasive surgery, but don't believe the hype. Malawi is a good country, and the healthcare system is pretty good here. So that's it. That's my 2 cents, and I hope somebody benefits from this.